Facebook Live. We're going to talk today about measles. A lot of you had asked about treating specific childhood illnesses homeopathically and what the sort of historical literature is on that. And there's some pretty good literature, and I wanted to start with one of my very favorite authors who wrote a book, and I've done another video log with this by a writer called, a homeopath called Dorothy Shepherd, who is my hero. And she wrote this book called Homeopathy in Epidemic Diseases. And she writes about measles. Back in the day, there was no measles vaccination. There was no MMR, no measles vaccination, and children just got the measles. And the result of that was that doctors knew measles when they saw it. They could identify it. And today, because measles has been virtually eradicated, there's not a whole lot of it. A lot of other rashy things, feverish and rashy things, get mistaken for measles. There's a lot of fear about measles. And for all those children who are vaccinated and have the measles, homeopathy is great treatment. All those children who are not vaccinated and get the measles, homeopathy is great treatment. Homeopathy is similar, finding the simillimum to the symptoms of a disease and then applying it, and with some very, very good results. So I'm going to talk a little bit about what Dorothy Shepherd thinks about measles. So what she says here is that as an acute infectious disease, there's an acute infectious disease with a sharp fever and your characteristic rash, which fells its victims to early childhood, and only attacks adults who have not had measles previously. I had the measles when I was a child, so I have developed a fairly long-lived immunity to it, and I'm hoping that in my 60th year of life, I'm exposed to someone with measles so that my body gets reacquainted with a wild-type virus, and I get an immunity for the rest of my life. But that may not be my lot in life. So it only attacks adults who have not had measles previously. Hi, Alyssa. Hi, Gordon. And hi, Brett Shelpline. How are you? The story of several attacks of this disease are unauthenticated unless supported by the evidence from a hospital actually tested the virus for food, drug, and serum rashes are often mistaken for measles by lay people. A lot of lay people, even a lot of doctors, mistake a lot of non-measles diseases for measles. Until recently, measles was thought to be a mild infection and not worthy of the attentions of a doctor. This assumption is not always the case, however, because back in the day, this book was written in 1967, when measles hits an unsalted, non-immunized community, such as the population, non-immunized in that day meaning a community that has not had a previous occurrence of measles, not immunized as in vaccinated or not vaccinated, but a community that's never experienced measles, such as the Fijian Islands in 1875. Did you know they had measles sweep across the Fijian Island? It spread across the island with extreme rapidity and killed 40,000 out of the 150,000 inhabitants. That's what they say. Incubation is 21 days and the invasion period is 2 to 3 days. However, our community, our civilization has been exposed to measles, so it's a lot milder in today's civilization. Severe cutter of the eyes, runny eyes, nose, with sneezing and violent, dry, and short coughs are the preliminary symptoms. So you could mistake it for a flu, you could mistake it for the coronavirus, a whole bunch of different things, because in the early going, you're getting the severe cutter of the eyes and nose with sneezing and violent, dry, and short coughs. Those are the preliminary symptoms. And this early stage is difficult to diagnose between a simple cold and measles. So you can't tell whether you have a cold or measles. And you're going on the assumption that it's a simple cold and applying a homeopathic treatment that as if it were for a simple cold. And let me tell you, that will help. Hi, Ramashankar Chowdhury. Howdy. Okay, so Incubation is 21 days. The invasion period is 2 to 3 days. So it's going to incubate, then it's going to invade. And in this early stage, it's difficult to diagnose between a simple cold and measles because both show a high degree of infectivity. Koplik spots, these are little minute whitish flecks, should be looked for inside the mucous membrane of the mouth. You open the mucous membrane of the mouth and you see little white spots that are an indication. The skin rash shows itself only in the 3rd or 4th days. So this Facebook live stream is actually for moms who are not sure. They're not sure, so they're living in fear. So moms, you should not live in fear. Read up on the symptoms of measles, especially if your child has just had the measles or if your child has not had, has been vaccinated and gets the measles. It's a good thing to know what the symptoms of measles look like. So look for Koplik spots on the inside of the mucous membrane of the mouth. The skin rash shows itself on the 3rd or 4th day, usually after a sleep. So you've been a little bit sick, you go to sleep, and the next day you wake up with a rash. The temperature goes up to 103 to 104. It's a sudden temperature increase. A smooth pink blotchy macular rash begins behind the ears. So it's going to begin behind your ears here. It's going to spreads from there over to the face, from behind your ears to over the face, neck, and chest. Later, these blotches coalesce, meaning these blotches connect together with one another. The appearance of a measles case is not characteristic. And that's the main thing to remember. Yes, pustules as well. The appearance of a case is not necessarily characteristic. You could get a puffy, blotchy, swollen face, swollen eyelids, narrow palpebral fissure with injected conjunctivi, a swelling here. The eyelashes could be matted together with thick, purulent discharge. The child is miserable and unhappy. And folks, all children are miserable and unhappy when they have a childhood fever, rash, cold, or cough. That is the right of childhood. That is when the child's immune system is learning disease from self, disease from good things, and the fever is the body's indication of an understanding of what's going on, and it's an adaptive mechanism. The purulent discharge is an adaptive mechanism to the virus that has taken root in the child's body. The child is miserable, he's unhappy, he avoids the light, he's photophobic, and resents being examined. So he does not like doctors looking, pouring into his, looking at his tongue and nose and so on. After a period of 5 or 7 days, the rash begins to fade, the temperature falls, a brownish staining of the skin remains for a few days. So the skin is stained a little brown for a few days. In a mild attack without complications, the child is well within a fortnight. Complications are unfortunately common and serious, such as bronchitis, blepharitis. Bronchitis is the cutter goes into the lungs and causes complications there. Blepharitis is eye infections, bronchopneumonia, if the child gets pneumonia afterwards, emphysema of the lungs, fibrosis, cavity formation of the lung, and so on. Whooping cough is another most serious complicating factor, and the mortality rate of the combined diseases is high. Back then, there's rarely, back then antibiotics were present, but not practiced a whole lot. Middle ear disease and mastoid trouble, croup or laryngitis may follow. Hi, Isabel Brunmeier. You just overdosed the kids on IV, vitamin C when the initial symptoms occurred. That's a very, very good idea. But middle ear disease could occur, mastoid trouble, croup or laryngitis. So basically, Dorothy Shepherd is going through the laundry list of bad things that could happen that you should be aware of. And all of these folks have Latin names, but they're explicable. And if your child's immune system is healthy, if they've been eating good food, and if you know what to do homeopathically, you will go through this minefield with very good results for your child. Your child will come out of the fever much stronger than before with a lifetime of immunity. It is difficult to control an outbreak in a school. The advice most generally given now is to isolate the contacts from the 9th to the 18th day after an infection, but they escape. A few personal notes may be suitable at this point. During her several years in general practice, she went through 4 epidemics. So Dorothy Shepherd, if anyone has experience with measles epidemics, it is Dr. Dorothy Shepherd, homeopath, MD turned homeopath, with several hundred cases seen. She was fortunate enough, with the help of the homeopathic remedies, not to lose a single case. She did not lose a single case of measles to death. Though in the nearby neighborhood, one heard of many children who died of this disease. It was said that all my cases were extremely mild. That's what people say when homeopathic remedies are applied and the case turns out to be extremely mild. They say it was never serious anyway, but strangely enough, all of her patients turned out to be mild cases, and in the nearby hospital, there's a lot of mortality. The most usual remedies necessary in measles are, and you want to write this down with a paper and pencil, all the mamas who want to be ready before these things hit. The key is to be prepared and not go shopping on Amazon or Washington Homeopathics when your child is sick. So the remedies you want to have on hand are, number 1, Aconitum. Number 2, Antimonium Crudum. Number 3, Apis mellifica. Number 4, Arsenicum. These should be medicines in your arsenal at all time. Number 5, Belladonna. Number 6, Bryonia. Number 7, Eurphrasia. Number 8, Gelsemium. Number 9, Ipecac. Number 8, Phosphorous. Number 9, Pulsatilla. The next one is Rhus tox, and the last one is Sulphur. So if you have these remedies, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 remedies. If you have these 13 remedies on hand, you can deal with the measles epidemic in your family or in your neighborhood just fine, and your child will do very well without consequences from the measles. The number 1 medicine to give is Aconitum. Aconitum is given as a routine measure in all kinds of fevers and high temperatures by some doctors. This habit, she disapproves of this habit, and what she's saying is this habit only causes trouble and may delay the healing process. Aconite is specifically indicated for a definite type of measles. A chubby, rosy, robust, well-developed child is stricken down. A beautiful, chubby, rosy, well-developed child is stricken down rapidly with a dry cough, some retching, intense fever, violent burning heat, great restlessness, and he throws himself about. She throws herself about. There's a lot of anxiety. Aconitum, anxiety. Aconitum, anxiety. He may have been out that day in a cold, icy wind. There's thirst for cold water, of which he cannot get enough. Glassy eyes with a red face. Very glassy eyes with a red face. If you give Aconitum to such a child, the rash will come out the next day, and in 2 or 3 days, that child will be well. If Aconitum is given to an infant which has not got the red face, the restlessness, the fearfulness, with great thirst, you will get no response, says Dorothy Shepherd, and you'll have to change the remedy a day or 2 later. So it's very important to look at the symptoms when you administer these remedies. And this is I just love this homeopath. She had enormous experience and very good success with measles outbreaks. The second remedy is Antimonium Crudum. And Antimonium Crudum measles looks like this. The child is ugly and cross and peevish. Cannot bear to be touched or even looked at. The nostrils are, as well as the corners of the mouth, are sore and cracked. Nostrils and the corners of the mouth. He has a hot red face like aconite. This is true, but there's no thirst, no anxiety, no restlessness. Instead, this child is delirious and drowsy. That is an Antimonium Crudum measles. The tongue is covered with thick, slimy, milky white fur. He will retch and eat and gag easily at any food that is offered to him. He objects to a hot room. He objects to a hot fire. He does not like the heat. That is an antimonium crude measles, folks. The third type of measles is apis, and apis case is very different again. The face is puffy. So this gives you an idea of what kinds of medicines to use. If you have 4 children who get measles, and each of them exhibits different symptoms, a different remedy is applicable. And it behooves you to educate yourself on the differences between these remedies. And what will happen is, over time, it'll be like making a beautiful fish curry. You'll just know what to put in for a Goan fish curry, for a Thai fish curry, for a Cambodian fish curry, and unerringly you'll go to the right spices to make the right combination of foods. The third remedy is apis. And so here the face is very puffy, swollen red, the eyes are swollen, the child is delirious. And apis, swelling, and delirium, gradually becoming unconscious. The eyes are intensely red, the face is flushed, worse when the room is hot. There will be shrieking and falling and calling out during, not falling, calling out during sleep. The rash is not properly out. You might almost, because the face is puffed, you might almost say there are meningeal symptoms present. Swelling, meningeal, brain inflammation. The head may be drawn back and held rigidly. The child refuses hot drinks and hot applications. Give apis to such a patient and the threatening meningeal symptoms and the brain cry. The brain cry is oftentimes when a child is vaccine damaged, you hear this unbearable shrieking. Many of you may have experienced that when perhaps your children are vaccinated or your neighbor's children were vaccinated, and that's when the brain membranes get inflamed and there's this intense pain and the child is screaming, and a deathly scream that's not like a regular child's cry. And an apis measles is very much reminiscent of an encephalitic or brain swelled measles case. The cry will disappear when you give. The child refuses drinks and hot application. You give apis to such a child, the meningeal symptoms disappear, the crying, the meningeal shrieking will disappear. The rash will come out rapidly, temperature will go down, and within 3 or 4 days, you will hardly remember that you had such a sick child to look after. And so this is a description of a person, of a child that's stricken down with measles who has more swellings. Arsenicum has the usual symptoms of restlessness. So the next remedy is arsenicum, and it has and folks, these symptoms are applicable not just in measles, but a lot of other infectious diseases. And if you get a flu with some of these symptoms, you can read or view this live stream or this video and get an idea of what sort of remedies to prescribe yourself. It's not rocket science, and it works. It works great. So anyhow, arsenicum has the usual symptoms of restlessness, weakness, perspiration. The patient feels chilly. The child feels chilly and wants to be well covered with a desire for sips of hot fluids, cold drinks being refused. And arsenicum will clear up this case in a day or two. And you will think, oh, gee, or someone will think, gee, it was not measles. It is measles. If you apply the right simillimum, the body's immune system cures that disease or deals with the disease in short order. The next one is Belladonna. And Belladonna is your high fever, hot face, red hot, glassy eyes, your typical Belladonna symptoms. And if you see a child with those kinds of symptoms, then Belladonna is the theme of that measles. Bryonia is the next remedy, and it's perhaps the most commonly needed remedy for measles, she said, in the UK, but depends on the weather. In certain parts of the United States, Bryonia may well be the remedy and not in certain others. It corresponds to the tempo of measles. It comes on slowly. So if your child's measles comes on slowly and gradually, the symptoms take 3 or more days to develop. there's symptoms of mild cold. So first the child is kind of under the weather, it has a mild cold, mild cutter, then it gets a hard, dry cough, and in 3 or 4 days, the rash comes out fully. The face is heavy. The face of the child is going to be heavy, congested, and dusky looking. So there's a dusky hue to the face, and you can see that. He looks stupid and benumbed, so she's trying to imply he doesn't look like he's thinking. The child is benumbed and dazed and wants to sleep all the time. He just mutters, but does not talk much unless he's disturbed, when he will rouse up and say in a disagreeable voice, "Go away." So this is not a Pulsatilla child. This is not a child that wants you to hug him and coddle him and cover him up in blanket. He just wants to be left alone. That is a Bryonia measles case. And I know some adults who are like that too. The drowsiness and muttering, delirium is worse after 9 o'clock. Hi, Smita. Good to see you. The child wants to be left alone and wants to be kept quiet. He keeps quiet still because he's worse from movement. So the child gets sicker, feels sicker from movement. So the child is very, very still. That's a Bryonia case of measles. That's a Bryonia case of the flu as well. The person doesn't want to be disturbed. He hates a stuffy, overheated room. He will then throw off his bedclothes and the muttering will be aggravated. On opening the windows and letting in fresh air, the child will drop off to sleep quietly. The tongue is thickly coated, dry, brown, and cracked, and the child has great thirst for large quantities of water at long intervals. So this is typical Bryonia. So if you look at any materia medica, those are the symptoms of Bryonia. The perspiration is free, and she points out to this in the case of measles specifically. These are the things that happen. The perspiration is free. In the English climate, which is deep maritime, Bryonia, or in any kind of maritime climate, which is kind of wet, Bryonia should always be considered for all acute diseases, and will be the answer in many cases of measles, German measles, and other epidemic diseases. So when you think epidemics, yes, there is a disease running through the population, but in a case like measles, frequently you will see clusters of symptoms, and they will be very, very similar, and that's what they call the genus epidemicus, which is if everyone has Bryonia symptoms, doctor will say, oh, that's a Bryonia measles, or that's a Belladonna measles, or that is a, Eurphrasia measles, depending on the symptoms. So, any questions? No questions. Okay. As an example, she cites an example of a child of 11 that had not felt well with a temperature for 3 days. I was just feeling under the weather, the child was. The rash came out in the afternoon after the child had been drowsy all day, temperature 104 to 106 at 4 p.m., drowsy, stupid, flushed face, dusky, rouses up now and then asking for water, taking a good cupful, and then lying back again to sleep. You're welcome, Chad Franklin. Chad Franklin says, thank you very much for the information. Yes, and the reason I'm putting it out there is disease is not something to be scared of. Disease is something to understand, and especially if you're a mom with children, it's something that you need to educate yourself on, because disease is going to strike when the child is with you at home, and the more you know, the less you'll need to go to doctors or emergency rooms or panic or give the child antibiotics or steroids or Tylenols, and the better the health of the child will be. A child that grows up without all of these allopathic measures is going to pass on good health to his children or her children and the next generation. So really you're doing homeopathy as an intergenerational favor to your child, your child's child, and so on. And a course of antibiotics, first, it's useless, and it has hugely deleterious effects on the child down the road and during the course of his life. So anyhow, we're talking about the Bryonia measles, typical dry measles cough, the wrong high all over the chest. respirations are 36, pulses 148. So you should learn to take pulses, you know, just take a little stopwatch, take a pulse. It could be 36, it could be more, it could be less. Take a pulse. Pulse is 148 in a Bryonia case, and the respirations are kind of small, low, 36, and a high temperature as mentioned before. Bryonia and water given to hourly. Temperature next morning, 99 degrees. The day after, 36 hours after the rash had come out, the temperature was normal again. So she's citing a case. The rash was almost gone, no pains, no headaches. The child's chest was clear, all adventitious sounds, very much, not just very. Chad Franklin says, thank you, yes. Temperature the next morning was 99 degrees. The day after, 36 hours after the rash had gone out, the temperature was normal. The rash almost gone, no pains, no headaches. Chest was clear, all adventitious sounds in the chest disappeared. Ravenous for food. When someone is ravenous for food, that means they are well. Extremely lively. Kept in bed for a couple of more days. Let the child rest after they have gotten over something like this, even though they might want to get out of bed and play. Just let them stay at home. Allowed to get up on the 5th day. Went out into the garden on the 6th day, as it was nice, warm, mild day. Seen a week later, well, and no complications followed. And one of the problems I see is children are in daycare centers, they get sick, the parents are working, and there's this bias to send the child back to school, back to daycare center. Folks, the time when your child is sick, it is time to slow down. You earn a little bit less, you know, work it out with their boss, work it out with the school teachers. Disease or illness is a time for rest for the mom, for the child. It's a time for bonding. There's a great emotional bonding when you hang out with your child when they're sick, and it leads to speedier cures. So there's something to be said for, first, understanding an infectious disease. Number 2, not fearing it. Second, understanding and educating yourself on the symptoms. And third, embracing it as a time for a great deal of bonding between family members and for greater health down the road, where you're not going to get chronic diseases down the road if you've had these searing acute infectious diseases. So an acute will pull out a chronic, they say. If you get an acute, a rip-roaring fever, a rip-roaring diarrhea, or vomiting that sort of cleanses your system, your immune system is revved up, you're not going to get acute diseases where your body's sort of operating at a low level. You don't quite get a fever, but you don't feel well. It's like a permanent flu. So we today have a society of no acute diseases because they've all been eliminated, exterminated with vaccines, and massive epidemic of chronic disease where your child is constantly sniffling and sneezing, or has allergies, or has a whole host of asthma, a whole host of conditions that are lifelong and far, far more misery making than a 3 to 4 day bout of an infectious disease that, when properly curtailed, leads to good health. All right, the next remedy is Eurphrasia. And this is the remedy par excellence for measles with inflammation of the eyes and the eyelids. Remember they used to say measles can blind you? Well, Eurphrasia is your remedy. Guttural conditions of the eyes with profuse burning tears. Profuse burning, stinging, acrid tears coming out of the eyes. I don't remember what I had when I had my measles. I just remember being at home and my mom fussing over me, and then a week later I went back to school. The lids of the eyes burn and itch, but I didn't get any drugs of any kind because my mother didn't believe in those. The lids of the eyes burn and itch and are swollen, rash about the eyes with puffiness and bloating around, much sneezing and running of the nose, profuse, non-irritating cutter, that is runny nose. The nose is streaming more when lying down and more at night. while the dry cough is better on lying down and worse during the day. An intense headache, photophobia, meaning lights really bother you, with a high temperature. When these symptoms are present, give Eurphrasia 6 or 30 2-hourly in water, and the temperature will be down in 24 hours. This is what Dorothy Shepherd recommends. In 24 to 36 hours, the rash will have faded. In 2 to 3 days, keep the child indoors for another 2 to 3 days in a well-ventilated, airy room, protecting the eyes. You got to protect the eyes because the eyes got the brunt of the illness in this particular case of measles. And cod liver oil. I can't say enough about fermented cod liver oil. The first sign of anything I take, and I give my entire family fermented, and I swear it curbs the disease by several days, several hours, if not several days. Love it. I can feel the instant difference when I imbibe the vitamin A in cod liver oil. Get the fermented kind, the one that's not been processed. Let the child go out of doors for a short time on a fine day, and there will be no more chest complications, no bronchopneumonia. Inflammation of the eyes will have disappeared entirely. There'll be no falling out of the eyelashes, no disfiguring attacks of blepharitis and conjunctivitis. And there are all these tales you hear about the old-time hospitals where children went blind and maimed and died. When you know the right simillimum to apply to a child's measles, you will not have these complications. And it behooves every mother to know these, 8, 10 remedies so that you're always prepared. And write it down so that when you see the symptoms and you're too freaked out to do anything, you can consult a card or a little piece of paper to see what you need to do. All right. So you're not going to get any eye troubles, as is often the case with measles treated in the orthodox fashion. This is not a fable, she says, but fact based on experience collected over a number of years. The next remedy is Gelsemium, and that is needed when the measles develops in a warm, mild winter, or in June or July, in a June or July epidemic. The disease comes on slowly. There's a cold with a cutter. It's sort of a cold for several days. There's tiredness. There's a weariness of the whole body and the limbs. So you're just tired. The limbs are heavy and seem like they weigh a ton. It is too much trouble to move them, so the patient doesn't want to move. There's a congested feeling in the head and face, which looks purplish. You're looking for a purplish face, a congested, purplish feeling. The eyes are swollen, and there's profuse shedding of tears. Shuddering down the back as if it were rubbed with ice, so you get these shudders. Always remember the great tiredness and weariness and disinclination to move, although the cause is quite different from the disinclination to move in Bryonia, where you're also disinclined to move, where it's due to actual pain on movement. Gelsemium does not move because of the weight of the limb. So in Gelsemium, there's not pain, there's weight. In Bryonia, there's pain in the limb, and your child should be able to tell you. Typically, you get measles when you're 2, 3, 4, 5, 6, all the way to 11. They should be able to talk and tell you, Mom, my limbs feel like they weigh a ton, or my bones hurt, And so those are two different remedies for two different circumstances. So Gelsemium does not move because of the weight of the limbs. Neither is there any thirst. In Bryonia, there's thirst. In Gelsemium, there is no thirst or craving for water. It's very specific. And you give Gelsemium 6 or 30 in 2-hourly doses in water. It'll clear up the disease in 2 to 3 days. The next remedy, which is also very cool, is Ipecac. And it's indicated in cases of measles where there's nausea or vomiting, great weakness and prostration. I always say prostration, with absence of thirst. So in Ipecac or in a certain kind of measles, there's no thirst, you're vomiting, you're barfing up, there's nausea, The rash is slow in coming out, and the gastric upset shown by the nausea and vomiting is accompanied with a flushed, bright red face and clear tongue. So the tongue is clear. The tongue is clear, the face is flushed, bright red, and they are puking. And the Ipecac will stop the gastric symptoms and the dry cough. The rash will appear within a few hours, as always, and the child will be well without any complications following within a couple of days. So any questions? There's a lot of people who have joined. Post your questions down and I'll try to answer those. The next remedy is Bichromum, and it resembles Pulsatilla. It's useful at a later stage of the disease, or especially if you didn't get it or wasn't treated before, but the discharges from the eyes, nose, and mouth are more profuse, purulent, stringy, and ropey. So ropey and stringy things are coming out of the ear, nose, eye, nose, and mouth. The glands of the neck might be swollen, and there's deafness due to the cutter extending to the eustache. The tubes are blocked, nose is blocked, eyes are blocked, sinuses are blocked, and that is a Bichromum measles. The next remedy is Phosphorous. And a Phosphorous measles case is one where you have involvement of the chest. So the measles, the cutter goes right down to the bronchioles, the bronchial tubes in the lungs. The respirations are rapid, so the child is breathing shallow, like that. The respirations are rapid. The pulse and temperature are very high. There's great thirst for cold water. There's a bright red flush on the child's cheeks. The head is thrown back because they're trying to breathe. They can't breathe. It is a serious case, and without this remedy, which is Phosphorous, you would expect serious trouble. But Phosphorous will soon alter the picture. Chesty, cold, bronchial cutter, deep inside the lungs, measles with these symptoms. The RX is Phosphorous. It will soon alter the picture. Are you getting it that each of these remedies almost has a picture? So you imagine a child with that picture, whether it's a child with a chesty cough, a child with very high fever, glassy eyes, red flushed face of Belladonna, a child that doesn't want to move at all, and it's hurting, and the measles came on slowly, that's a Bryonia child. So there are these pictures that the images that I'm sort of trying to put up before your eyes, so that intuitively you as a mom or dad are going to know exactly what remedy to administer. All right, the next one is Pulsatilla. This has the usual measles symptoms with the red blotchy rash, high temperature without any thirst whatsoever. You will find a very depressed, weepy, and whiny child who dislikes being left alone, wants his hand held, and a lot of fuss made of him. So these are the clingy children, the Pulsatilla children. They do not want to be left alone. They want their mom and dad to cuddle them, like my grandson. When they're sick, they want the whole world to pay attention to them. They have a rough, blotchy rash, high temperature, no thirst at all. They don't like being left alone. They want their hands held and a lot of fuss made of them. They want constant attention, as opposed to Bryonia, which does not want any attention whatsoever. Pulsatilla, Dorothy Shepard says, Pulsatilla will brighten up this child, reduce the temperature, and clear up the rash within 2 to 3 days. That's the power of Pulsatilla in the right circumstances. The third to last remedy is Rhus tox, and a lot of you probably know Rhus tox. It's for deep muscle aches, from getting wet, from gardening, arthritic pains, and so on. So a measles Rhus tox is a restless child with the usual common measles symptoms, full of aches and pains. So they have aches and pains. They throw themselves about in the bed at all the time. But there is an absence of, in Rhus tox, there's no fear or anxiety. In Gelsemium, you might have fear or anxiety. In Rhus tox, there's no fear or anxiety. The tongue is covered with a whitish fur with a bright red tip. and some thirst is present, but not a lot. So that's a Rhus, tox, measles, child. The next remedy is sulfur, and this is useful in a child without any particularly strike. So if you strike out, you're struck out, can't find any of those exact symptoms that I mentioned earlier, except for the common measles ones, which is the rash, the congested blotchy face, the dirty tongue, and the itchy skin. And the child is worse in the morning at about 11 a.m. Sulfur is often indicated, Dorothy Shepard says, in cases of measles that are seen late after they have already been treated by other practitioners and they did not have success. So that's when sulfur is sort of a hard hitter, last resort. The weakness, and sulfur has debility, so there's a lot of weakness. See, if you give the right similimum in the early going, there's not going to be this debility. But frequently, children that have not been treated with the correct remedy or with the correct anything, or may not even have been diagnosed, they have suffered extensively, and by the time you get to them, there's a great deal of weakness, and sulfur is the right remedy at that time. The weakness, debility, and lack of reaction, she says, will disappear immediately after sulfur is given. And Kent is a great, he was a homeopath, I think in the 50s in the United States, and he's written this Materia Medica that is just awesome. Yeah, it reads like a novel. It describes every remedy so beautifully, and Kent says that routinists do well in measles with Pulsatilla and sulfur, occasionally requiring aconite and Eurphrasia. So when in doubt, they use Pulsatilla and sulfur, sometimes resorting to aconite and Eurphrasia. But you guys can do better because you now have at your disposal this arsenal of great remedies. And the very last remedy is Morellinum, and this is very useful. It's called Morellinum, Morbillinum, Morbillinum, extremely useful for cases of debility. Weak eyes, blepharitis, conjunctivitis, etc., left after you've had the severe measles. So after a disease, typically you find, people feel weak, people have lassitude, they have debility, they get depressed, they might have symptoms they didn't have before, and you want to treat those homeopathically as well. There's Ignatia, great for anxiety and depression. There's Aurum metallicum, great for anxiety and depression or debility after an illness. And in the case of measles, Morbillinum is extremely useful for debility, weak eyes, blepharitis, eye troubles. Left after severe measles, treated in fever hospitals. So there are many fever hospitals back in the day, children who simply will not put on weight or are anemic, or were treated in an orthodox fashion with a lot of, antivirals and antibiotics and steroids and painkillers and NSAIDs. Those are the children that will benefit from Morbillinum. These are the children who don't put on weight, who are anemic. I could have used this back when I was very young and I had hepatitis, and I lost a lot of weight, and that affected my growth later on in life. I caught up later on, but had I had access to good homeopathic treatments, I think that could have been avoided. Will help to remove all these symptoms, prevent lung complications down the road, so knock on pneumonia, bronchitis, affectations of the lungs, or eyes, and help them to assimilate their food well and to put on weight rapidly. So that is Dorothy Shepard's take on measles, how to identify it, how not to freak out, how to find or identify the white spots on the mucous membrane, the blotchy red rash, how to identify your child's symptoms, specific symptoms, and administer the right remedy. Hi, Marlene. So nice to see you. Yes, a lot of these are applicable to a lot of other illnesses as well. And in final word that Dorothy Shepard gives, final advice she gives us is, for those who may, and this is wonderful, who may not have dealt with the case from the start. In suppressed eruption where the brain is affected, remember, Apis, Zinc, Stramonium, and Cuprum, where there are cramps, convulsions, spasms of the fingers and toes, and when the patient starts like that in his sleep. Also think of Helleborus, when the child lies in a state of deep unconsciousness from which he can hardly be aroused. So, in summary, the remedies that we talked about today, just now, for measles, I'm going to reread them to you, are Aconitum, shock, wind, sudden, cold winds, Antimonium, Crudum, Apis, Arsenicum, Belladonna, Bryonia, Eurphrasia, Gelsemium, Ipecac, Phosphorous, Pulsatilla, Rhus, Sulphur, Morbillinum for weakness, great debility, and in certain other circumstances, for certain other symptoms, Apis, Zinc, Stramonium, and Cuprum, cramps, convulsions, spasms of the fingers and toes, and Helleborus when the child is in a state of semi-consciousness. So those are the remedies I would recommend every mom get in her war chest, or get one of those kits of 100 remedies, and you'll knock down the cost by quite a bit, and just have them on hand. The good thing about homeopathic remedies is they will not kill you. They don't have side effects. At most, you might be applying the wrong remedy, but that's okay. You'll live and you'll learn, and your child's health will not be further impaired. In the event that you have one potency and don't have the other, give the potency you do have. It's better to give them what you have if you don't have what they need precisely. You'll also find that there are other remedies than the ones that Dorothy Shepherd spoke of, but this is an experienced homeopath with tremendous success, who has written wonderful, wonderful things for the common mommy, grandmom, homeopath, or the home homeopath, who is looking to confer health upon their family and doesn't want to go to the ER every time the child has a fever or sprouts a pustule on their mucosal membrane. And these are the things that you can easily do, readily do. The main thing is you have to have the remedies on hand. You have to observe, which means you need to be cool-headed and not freaked out when your child is sick. You'll help the child a lot more by being level-headed and observant rather than by weeping or getting too stressed out. And the child will get better much, much faster. If you have any questions, or if you have alternate remedies that have worked for your child when they had their measles, please post them down below. But try these and enjoy prescribing homeopathic remedies for yourself and your family. Have a great night, everybody.